Hi, I'm Dr. Bing Hu. This is my colleague, Dr. Boson. We're all from Department of Gastroenterology and Endoscopy in the Eastern Capital Biliary Hospital, affiliated to the Second Military Medical University at Shanghai, China.
Thank you very much for having us in this awesome interview to introduce our current publication titled Asia-Pacific Consensus Guideline for Endoscopic Management of Benign Biliary Strictures. So Professor Hu, may I ask you, why did you feel a need to develop this consensus guideline?
Well, benign biliary stricture, the BBS, is commonly encountered in our daily practice. Traditionally, this condition was primarily treated with a surgical operation. In 2000, Dr. Cotter-Magner published a landmark study in GRE using multiple plastic stent strategy and achieving satisfactory long-term outcome. After that, endoscopic approach has played increasing role in this setting worldwide and become first-line therapy recently. However, as we know, there are a variety of benign etiology which can cause biliary stricture, and the treatment strategy and outcome can be quite different. Additionally, technique used in the endoscopic management of a BBS may be different even among experts, which we have noticed quite well during the face-to-face meeting discussion of this statement with other co-authors. Some new technique has been emerging recently and have already been used in selected patients. Although there are many publications regarding the diagnosis, the treatment, and the technique in management of a BBS, there is a lack of a formal evidence-based guideline which can be used to guide our practice or be used as a standard reference for training and teaching. I think that is why it is needed to develop this consensus guideline.
Yes, to develop this guideline, we first conducted a systematic literature review to collect all available clinical evidence, especially RCT clinical trials and the meta-analysis of RCT studies. After that, we developed more than 20 statements associated with the diagnosis and the treatment of benign biliary stricture. We then prepared our paper, emailed it to all of our co-authors, and to get their opinions, and asked them to vote for these statements. We revised these statements after having their feedbacks. Then we hold a face-to-face meeting of almost all of our co-authors a couple of months ago in the city of Shenyang, China. We discussed, revised, and voted again for these statements. And finally, we developed this consensus guideline.
This consensus recommendation was constructed in two parts with a total of 22 statements. In the first part, we addressed several general principles in the management of a BBS, including the etiology and its diagnosis, the role of endoscopy, percutaneous and surgical intervention. Endotherapy includes biliary access, dilation, standing, choice of stent, as well as the role of some novel endoscopic technique.
In the second part of our paper, we focus on topics regarding to the management of biliary strictures related to those specific etiologies, including post-liver transplantation, surgical injury, chronic pancreatitis, primary sclerosing cholangitis, IgG4-associated cholangiopathy, biliary enteric anastomotic stricture, etc. So we think it covers pretty much most of the topics in the field of endoscopic management of biliary strictures with benign conditions.
When we have a patient referred to us with, let's say, benign biliary stricture, there are usually several questions we would like to ask ourselves before we set up a treatment plan. For example, is it really a benign stricture? How to confirm it? What caused the biliary stricture? Is it indicated for endoscopic management? Any contraindication? What's the goal of the treatment? How to treat the patient? with a plastic stent or metal stent. Any evidence-based technique can be applied. Are there any backup plan if endoscopic failed? I think this consensus guideline provides currently available clinical evidence address most of this issue.
We tried to build these statements on clinical evidence of the highest quality that can be found in the literature. But experts' opinion and experience were also appreciated when clinical evidence are not sufficient. The level of evidence and the recommendation was also listed behind each statement to tell people how strong the evidence and recommendation is. We think this consensus guideline is not designed to tell people what is the best way to do. It's rather aimed to tell people what is the appropriate way to do, based on available evidences from clinical trials and on expert opinions. Hopefully, this consensus guideline could be used as a reference to guide our practice and improve the outcomes of endoscopic therapy of benign biliary strictures. It's a great pleasure to publish our paper in GIE.
Finally, I'd like to take this opportunity to introduce our group. Our study group, named the Asia Pacific ERCP Club, is another APEC. It is established in April 2015 by several ambitious GI experts from China, Japan, Korea, Hong Kong, Taiwan, Thailand, India, and the United States. The purpose of APEC is to draw on expertise to support both innovation and education in the field of biliary pancreatic endoscopy over Asia-Pacific region. We have been conducted several hands-on endoscopic training programs in our area, and a couple of multi-nation studies are on the way. This is the first consensus guideline of our APEC. I'd like to thank all the APEC members for their contribution to this publication. Wish the APEC will bring you more new achievements in the near future.
Thank you very much for your kind attention.
Thank you.